We bring on Dr. Todd Battaglia from SOS. Dr. Battaglia, board-certified, fellowship-trained orthopedic surgeon and head orthopedist for Syracuse University and Lemoyne College athletic teams. Dr. Todd, great to have you on. How are you today?
I'm doing well. How are you guys?
We're doing all right. Let's start in the NBA. And Victor Wembanyama shut down for the season with, I guess, what is essentially a blood clot. And we saw this with Chris Bosh, right? He had to shorten his career, cut his career short due to blood clots as well. Are athletes at more of a risk of blood clots than the average person? And what kind of treatment and recovery are available, to them? And is this a concern for Wemby and the future of his career? He's such a young guy.
Yeah, so it is a weird injury. Most blood clots are actually pretty common, but most of the ones we see either occur after an injury or a surgery when you're not as mobile, you're kind of laid up. Circulation is not as robust as typical. So for someone like him to get a blood clot, you got to wonder if maybe he might have a clotting factor disorder, which can make you more prone, or his is in the upper extremity in his arm. You can have some kind of ways you were born with an extra rib or a rib malposition that kind of kinks one of the blood vessels and makes you more prone to a clot. So ultimately, his long-term kind of risk is going to depend on what they decide was the cause of this. But, just like you see Bosch on the commercials for the blood thinners, Wemby's going to have to go on one too, and he's going to be on it for a while. So, coming back to play on a blood thinner, you're at a little higher risk of bleeding if you get injured in the whole 9 yards. So it's a pretty big deal.
All right, moving on to Joel Embiid. His saga continues. It seems like he's hurt every other year, and he's got this meniscus replacement procedure that he may reportedly undergo. It involves breaking a bone in the hip to realign the joint and alleviate pressure. To me, to the average person, that sounds like a risky procedure, risky operation. How common is that practice, and can you kind of explain, how it works, I guess?
Yeah, it is a pretty big deal. It's not uncommon. I wouldn't say that a lot of orthopedic surgeons do it, but those of us that do, it's not an uncommon procedure, but almost certainly what he's got is basically just he's developing arthritis on the inner side of his knee. He's had his meniscus trimmed before. He doesn't have a lot of cushion there, and so now he's developing actual arthritis. So what this combination of procedures would do would basically put a meniscus replacement, which is usually a transplant, a cadaver meniscus, to replace his own meniscus. And then the bone cutting procedure is called an osteotomy, which is essentially cutting and realigning the bone to shift some of his weight off the area that's more damaged so that when he runs and walks, more of his weight is shifted onto the good part of the knee. It's good surgery. It can work well, but to come back at an NBA level participation afterward, I would not be putting a lot of money on that.
On to another big man who always seems to be hurt, and that's Karl Anthony Towns. He's been dealing with something called jumper's knee, which I'd never heard of. Apparently he's been dealing with this for the last couple of months, and he tweaked his right knee in a recent loss to the Celtics. What exactly is jumper's knee, and how serious is that one? Is that something that might be a long-term thing for him?
Yeah, jumper's knee is kind of a generic term that refers to pain in the front of the knee in athletes, particularly who do a lot of running and jumping. It's usually just referring to patellar tendonitis, inflammation or tendonitis in that tendon that runs from your kneecap down to your shin bone. It's not serious in terms of danger. It doesn't really put him at a higher risk of bigger problems down the road. But it is serious in that it can become very sort of chronic and nagging. It can be very hard to get rid of, and there's not really a great surgery for it. So it's a lot of therapy. It's a lot of medication. Sometimes there's injections like PRP or growth factors, and I've got more than a handful of my own patients who deal with it for years, honestly. So it can be quite annoying.
All right, staying with basketball, but moving to the college game. One player that we're all familiar with, Malik Brown, plays at Duke now, suffered what they're calling a dislocated shoulder last week against Virginia. John Shire didn't provide an update, just saying that doctors didn't see anything abnormal as far as the injury goes. So what is the timetable for something like that, a dislocated shoulder? And, again, what kind of goes into the treatment and the recovery for that kind of injury? Should he be ready to go in time for the NCAA tournament, I guess?
Yeah, so almost always when you dislocate your shoulder, you do some damage. Typically, you tear what's called the labrum, which is some cartilage inside your shoulder. So when those guys say they don't see anything abnormal, I'm not sure if they mean he didn't tear it or they don't see anything outside the ordinary tear that you would see. But either way, he's not going to have surgery in the middle of the season. They're going to rehab him, and he'll probably be back playing. I would bet you within a month. He'll be ready for the tournament, typically. Question will kind of be whether it continues to bother him or is loose enough that it's a risk of dislocating again, in which time typically he might consider some off-season surgery to fix that.
And it was weird, like the play that it happened on, too. It didn't even seem like it was an unnatural play. Just went to deflect a pass, and it seemed like, his shoulder popped out. Just an odd thing, and obviously we all hope that he's better soon. Lastly, let's jump to baseball. Giancarlo Stanton, often injured, once again is starting another season injured. Says there's no timetable for his return. He's got tendinitis in both elbows. The question came up about why didn't he have surgery in the offseason. He said, I don't know. What do you make of this whole situation? And, how does one go about fixing tendinitis in both elbows?
Right. So it's weird to begin with that he's got it in both arms because, obviously in his position in baseball, just in general, they're doing two different tasks. So the best I can sort of glean from the internet is that it's kind of a tennis elbow type thing, which is tendinitis on the outer sides of your elbow. Comes from a lot of wrist motion and throwing, and probably the way he swings with such force and snaps his wrist maybe has contributed too. One of the reasons he may not have had surgery is because surgery is not that effective for a lot of tendinitis issues. You go in and you kind of clean up the damaged tendon and you sew the good stuff back together, but it's rarely, no pun intended, it's rarely a home run surgery. People who get it done say, yeah, I'm better, but I'm still not perfect. So they're probably trying to get him better again, just like the jumper's knee with therapy, medication, injection kind of thing, rather than jumping into a surgery on him.
If you were, say, a radio host and you were sitting just doing a radio show and your back locked up, what would cause your back muscles to lock up if you were just sitting doing a radio show?
So if I were that radio host, do I have back problems in the past, or
Yes.
is this kind of a new thing?
No, you've got back problems and neck problems.
Gotcha. So, hopefully it's just muscular, and I'd be doing some stretching and some anti-inflammatories and some heating pad. But I would say if it lingers more than, a week or two, or if it's causing any sort of nerve symptoms, numbness, tingling down your legs, any sort of bowel bladder type problems, then you got to be more worried along the lines of like a bulging disc or something, and you might want to get it looked at.
All right. That's good advice. And fortunately, I feel better.
I was just asking.
After
I was
a couple
worried
of
about
days,
you,
I
Steve.
felt better.
I was just worried about
Yeah, no, I appreciate
I was just getting a little expert help.
Dr. Todd, great stuff as always. We love having you on.
Sure.
Thanks for the information. Enjoy the rest of your week.
Thanks. Hope you feel better.
All right, thank you. Dr. Todd Battaglia.
You know what
from
you should do,
SOS.
Steve, is get one of those heating pads that the players wear before.
Yeah, well, then
During
people
the
will say I'm
show.
not taking the show
Yeah,
seriously.
yes, you're unprofessional.
Unprofessional. So I'll try to suck it up and get through it.
Can we make that your new nickname? Bulging disc Infanti? That's what someone in the chat went.
Got to be careful with that one.
Well, I don't get it.
Google search Charlie Steiner because he had trouble with that one time.
I don't know what you're talking about.
Back after this on ESPN.